Well, it's good to speak to the morning crowd. You're the most motivated, probably paying the most attention to what I'll be saying in the next 10 minutes or so. The ABOS is not your academy. It's not a specialty society. It's an independent provider of certification, plays by its own rules and policies that are approved by a superior organization called the Board of Medical Specialties, which is the other 23 recognized medical specialties that certify. And the mission here clearly is to serve the best interest of the public, but it also has value to those of you who are certified. This is getting to be ancient history now, but this was a Gallup poll paid for by the Academy back in the early 2000s. And there's no reason to think that this has changed very much, but most of your patients feel that you're certifying much more frequently than the 10-year cycle that you're on. And they think that it's a measure of quality. And you could see a lot of the marketing strategies of pharma and now many of the implant companies that market directly to the public say, you go to a board certified fill in the blank. So this is of some value to the general patient population that you're treating and to your fellow specialists in other areas of practice. The biggest change in maintenance of certification has been an online process called the Web-Based Longitudinal Assessment, which gives practicing orthopedists an alternative to taking a big exam every 10 years or going to Chicago and sitting before 8 of your peers in an oral exam. And it's been very successful. We now estimate almost 80% of certified orthopedists are participating. And what this process is a number of evidentiary articles are cited and put up on the ABOS website early in the year. And then during a period from April to mid-May, you select 15 of the articles that you've read, and an exam will be created for you of 30 questions from experts who have written questions and gone through the verification process. And you take that quiz every year, and if you pass 5 times, that's it. You don't need to sit for an exam. You don't have to go to Chicago and show your cases. So that's the alternative pathway. Seems very successful. And we're now completing the first 5-year cycle, and nearly 90% of those who enrolled have qualified and will be certified via this pathway. The ABOS did a pilot during the pandemic to see if they could grade you on your case submissions without you having to present them formally as in an oral exam, and that didn't fly. So it's not going to be yet another alternative for becoming recertified. There's a lot of pressure on the ABOS to shorten the length of recertification via the MOC. And ABOS has a track record here. Way back in the early 2000s, the Board of Medical Specialties did away with board eligibility. They wanted that term to go away. And your board was the only one of 24 that said, we're going to keep that. And board eligibility means you've completed a accredited residency and you've passed Part 1. That's the definition of board eligible. And lo and behold, all other 23 boards came around, and they now, once again, have board eligibility as a criteria, which is important to hospitals and insurers. They're asking that question, whether your boards are doing it or not. So the length of MOC has not changed. The process has changed slightly. in the past few years. And if you go to the website, you'll see what changes occur on an annual basis. This year, 2024, a slight change was made in the CME and self-assessment exam requirement. It used to be that when you recertified, you submitted an application and you showed evidence that you had done 240 CME credits, of which 40 were self-assessment. Now, every 5 years, you have to show that you've done 120 CMEs, of which 20. It doesn't sound like a big difference, but the board really cracked down on those who waited to the last minute to do all their CMEs. So that's worth paying attention to going forward. So MOC has done very well from the overall passing rate, and it still has 3 options for the knowledge-based portion. The exams, and the exam for trauma is like the exam for adult recon or spine. It's 150 questions written by experts in the field. You have nearly 4 hours at a computer center to take that exam. The ABOS is looking into security so you can actually take the exam on your computer at home, but they're not quite there yet, so you still have to go to one of those computer centers, which always gave me a little bit of a hair-raising on the back of my neck experience. They're not often the most fun places to spend a few hours when they take your phone and they take your watch and all that kind of thing. But that may change in the very near future to a home exam. Several other specialty boards are doing that now, and they're saying that they've had no security issues. So you are able to recertify even if you're not seeing patients. You don't have to be doing surgery. You just need to maintain your license and have your CME and self-assessment credits pile up to meet the certification. Everyone who applies to recertify through the MOC is judged by a committee of the ABOS, and they go into the community and ask for evaluations from those people you work with or who are familiar with what you're doing. And if the committee doesn't feel that you're clearly showing excellence in practice, they may ask that you take an oral exam if you're still in practice. Or they may ask you to submit additional CME and self-assessment if you're no longer in practice. So the ABOS may reach out and make some changes in your practice. As I said, any certified orthopedist can recertify. And MOC, like certification itself, is not a requirement to practice orthopedic surgery. It all depends on your practice environment, whether your hospital or surgery center requires it, and most actually do not. They recommend it. Some insurance companies will have a 2-tiered payment system, and if you're not participating in MOC, you may not have the same reimbursement as your colleagues who are. That's entirely a local situation. The ABOS has nothing to do with it. And as I outlined very briefly, the MOC is not just taking a test. You've got to have an unrestricted medical license. And here's that word unrestricted, which I didn't say before. If for some reason your state medical board has taken any action against you and you have a limitation, my advice is to hire a lawyer who knows healthcare law and try and get rid of that ASAP, because a restriction in the eyes of the committee that reviews your application is almost the same as not having an active license. So you want to deal with that, and you want to get on top of it right away. So the cycles, as I mentioned, the 120 CME, of which 20 have to be self-assessment, you now have until your 5th year to report that first session. And at the end of 8 years, if you've submitted all the appropriate CMEs and you have an unrestricted license, you can take the exam 2 years early. And there's no penalty. If you take the exam in your 8th year of certification, your next recertification isn't due till 12 years. So if you want to get ahead of the curve and breathe easy for a few years, by all means, get your CMEs, check your license, make sure the people you're in practice with think you're a good citizen, et cetera, and get your certification over with. As I said, the web-based longitudinal assessment, very popular. We're now seeing the first successful completion of that. Those first 5-year takers had to pass each of the quizzes in a row. Starting in 2025, which is next year, you only have to pass 5 out of 8 years. You don't have to pass 5 consecutive years. And that was built into the original way. The quiz in the middle of May, you have to get 80%. That is 24 correct answers out of 30 on your quiz. So the MOC online is definitely catching on. There will be further changes in the MOC process. The ABOS has had some recent turnover in staff, and they fell behind in posting changes on their website, but I am assured by the exec, Dr. David Martin, that they've caught up. They're fully staffed. They answer the phone in a pleasant tone of voice, and they'll answer your questions on the phone or at their website, which is abos.org. Make sure you're on track to keep your medical license intact. As I said, if any action is taken against your license, fight it. Go against the medical board with whatever it takes to get an unrestricted medical license. And once again, certification, maintenance of certification is like politics. It's all local. You may not need it to practice, and then again, you may need it to be fully reimbursed from some insurance companies. Find out what your local lay of the land is. I'm here for the whole meeting. Please catch me in the hallway or at the exhibits or something like that. I'm free to talk about it. There have been changes in the ABOS requirement for residency education. Doesn't affect this group directly, but I'm happy to talk about that with anybody as well. And I thank Ted and Amir for inviting me back year after year to hear this incredibly difficult topic of certification. Thank you for your attention. Have a great meeting.